Phase 2 cardiac rehab is a 36 session. If they came 3 days a week, that would be 12 weeks. And then Phase 3 is a maintenance program where after they've graduated from Phase 2, they can continue on into Phase 3, and that's lifelong.
I had a light heart attack. It was one of those ladylike ones. I just laid down in the yard and passed out. And when I came to, my children were bringing me to the heart hospital, and I thought, are they going to be embarrassed because there's nothing wrong with my heart? But there was.
People that qualify for cardiac rehab are people who have had heart attacks, bypass surgery, stents, valve repair or replacement, heart transplants, or stable angina, or also congestive heart failure. The cardiologist typically is the one who refers, and the cardiologist will send us an order for the patient, and then we will call the patient and get them scheduled. We do an initial assessment where they will come in and we'll go over all their medical history. We'll do a little bit of exercise to see where their baseline is, and then we will set them up for the exercise sessions, which are 3 days a week, Mondays, Wednesdays, and Fridays. We like to start patients 2 weeks after an event. If they've had open heart surgery, we usually wait 4 weeks, but as soon as we can get them started, the sooner we can start getting them well. When they come in, we put a heart monitor on them, and while they're exercising, we're monitoring their heart rate, their heart rhythm, and their blood pressure. And we start them wherever they are exercise-wise, and our exercise physiologist will work with them, and we increase their duration of exercise, we increase the intensity of exercise, and they're here for 36 sessions, so we increase those things the whole time they're here until we meet the goals that we've set for them.
Well, we start them out depending on their level of exercise. We may start them out with 20 minutes of exercise, and our goal for them is to get them up to 45 minutes of exercise.
We want them to be exercising at home on the days that they're not here. We also work with them on cardiac diets. We work with them on stress management, lowering blood pressure, lowering cholesterol. So our goals for them are that we see better outcomes. It's more than just exercise in that we do education. We have a pharmacist that comes in and talks about medication, dietitians that come in and talk about how to read the food labels. We have an exercise physiologist that talks with them about setting goals that maybe are inside rehab but also outside of rehab.
This kind of took what I originally thought to be a pretty dire event to nothing more than just a bump in the road.
You know, when a patient has a heart attack, for example, a lot of times they're nervous to go exercise, even if they were exercisers before they had their heart attack. It's a little bit scary to go back into the gym and just resume what you were doing. So by coming in here, we are monitoring them every step of the way. So if they have a problem, they're right here and we can take care of it. It just gives them that confidence.
I really have just enjoyed it. The nurses are great. I've met a lot of nice people. My doctors seem happy with me. And I'm in good physical health.
A lot of times we see people, they lose weight, they lose inches around their waist, their cholesterol's better, their blood pressure's better, and all of those things make their risk of coming back with another heart attack a lot lower. I see patients who are a little bit hesitant to do rehab, and then they come in, and I've never seen a patient say, I wish I hadn't done this program. Every patient that graduates is very, very thankful. You just see the change in people and that they can get back to living and doing what they did before their cardiac event.
Changed my whole outlook on the future.